Okay, this is rather a different review for me. It's kind of based on a gadget, but it's a gadget that was used on me rather than me using it. Namely, a laser for cataract surgery, or as they call it on this thing, a pharmaceutification of cataract with intraocular lens implantation, whatever. Basically, I had a problem with my left eye, which I've never been able to see out of, to be honest. It's I've got astigmatism, but the blurriness that the astigmatism caused was getting blurrier and blurrier. And because I'm diabetic, I was told I needed to have this done. And I faced quite a few fears and dangers and challenges in my life. But I have to say, in this particular case, I was literally shitting a brick. Mainly because people were coming up with phrases like, oh, once the needle goes in your eye, you'll be all right. And I don't know about you, but the thought of a needle going in the eye doesn't exactly please me. So I was kind of stressed out. So I thought, now I've had this procedure, if there's anyone else out there that's going to have one, it might help just to share my experience. Now, first of all, as some of you will know from some of my other YouTube videos, I work in a hospital, but I am not a clinical person. So this is purely a personal observation. Please, if you have any doubts, can speak to your GP or medical professional. So this is really just what I felt. So the first thing is, I felt terrified, if I'm honest. But anyway, I had a few tests. I had a pre-op. I have to say it took several months before I actually got the appointment. I also say that they did say that there might be some cancellations, but because I work full-time in an hospital and shifts, that wasn't really something I could to do. So, I had to wait. Anyway, I went to Queen Mary's Hospital in Sidcup, which is my local hospital, technically. And I went along to the eye surgery clinic and waited my turn. Now, I will say, if anyone's ever worked in a hospital, you will know that the NHS is under a lot of strain. And it was no different here. They were very busy. I think they were doing at least 20 of these things a day, which is good in so much as it's a routine operation. But that long wait just added to my anxiety, but that's by the by. I also have some other health problems, including some damage to my lumbar region and a touch of reflux. So I discussed that and said, is there any chance I could sit up, because I knew that the normal thing is to lie flat, and was told not really. So I was dreading that possibility. The last thing you want to do is throw up when you're having your eyeball lasered. But I have to say they managed to make me quite comfortable. So what happened? Okay, so after the wait and seemingly endless eye drops to help the pupil dilate in my left eye, I was then led to the lovely named needle room for the anaesthesia. Now, the first thing they did is put a couple of drops in the left eye, in fact a few more I think, which numbs it. The needle bit was the bit that terrified me. Now, the strange thing is, I mean, they cover your face with gauze, so you don't really know what's going on. But luckily for me, I guess, the consultant that was doing the operation was teaching someone. So she was explaining what she was doing to them, which meant I got to eavesdrop, so to speak. But anyway, the needle doesn't go in the eye, it goes down the side of the eye, and I heard them say that it was a soft needle, whatever that is. The end result, though, is that apart from a tiny little bit of pressure when they were pushing it round the back, I didn't feel anything. No pain, certainly, maybe a slight sting. And the idea behind that needle going in the back is to freeze the eye so it doesn't move, which is kind of useful if you're getting lasered. Anyway, long story short, I was covered with this gauze, heard them talking about it. You could hear noises, some very strange noises, including a very high-pitched noise that really sort of went into my ear. But needless to say, I kept as still as I could possibly do, although I was able to talk because they asked me how I was doing and so forth. It took them maybe 20-25 minutes, bearing in mind she was explaining what was happening, to basically laser off the cataract, for want of a better word, and then fit a new lens. Because I'm diabetic, they also took a few extra precautions and also put in what she called a thicker lens, which she said was better, but that the healing process would take a little bit longer to happen. So that was yesterday, and I was given an eye patch and a eye shield. The patch came off last night as per the directions. It could come off the night before or the morning. The shield should be kept on for 2 weeks at night, and that's mainly for two reasons: to stop dust and whatever getting into your eye, and also to stop you scratching it or touching your eye inadvertently. I found the shield they provided, which was a simple clear through plastic one, very awkward, because they provided it by basically using what we call stereo strips in the hospital, basically bits of sellotape, and because my eye was weeping, that kept falling off. So today I should be getting one with a band that goes around your head, ordered from Amazon. Also, you are advised to, in my case, 2 lots of drops. The reason for the 2 drops, and I'll explain, well, I won't explain, I'll tell you what they are: dexamethasone and neomycin and polymycin B and nepafenic. I think one is kind of a steroidy kind thing, and the other one is like an antibiotic, antiseptic, whatever. You've got to put 3 of those, one of those goes in 3 times a day, the other one 4 times a day for a month. Couple of things to bear in mind: keep out of the sunlight or wear sunglasses. Do not work in any any area where there might be dust. Do not do heavy lifting. This is their advice to me. And certainly do not drive, because they've written in there that you are not supposed to drive until you get your follow-up appointment, which they reckon is between 2 and 4 weeks. So if you are in a job that requires you to drive, please bear that in mind. They offered me a sick note. I don't do sick. It's not in my nature to go sick. And I'm sitting at a computer most days. Yes, you have to be careful, but please bear in mind that my left eye, because of the astigmatism, I could hardly see out of it anyway. So I always wear these glasses to do that. And that's really about it. Any pain? No, not really. A little bit of a sting. I guess, well, I mean, I'll try and do a little bit of a close-up, but clearly my eye is bloodshot, but it's working okay as far as I can tell, bearing in mind it's only been 1 day. And my lovely wife is very kind, and she was driving me. She's helping me because I have a bit of adversity, strange enough, about putting drops in my eyes. She's helping me do that. But I found a little eye drop dispenser also on Amazon, which should be arriving tomorrow. So next week when she goes back to work, I'm going to try and use that to make it easier for me. But was all of that fear, all that stress really warranted? The honest answer is no. The procedure itself was short. It was pretty much totally painless, easy to do. Granted, if things go wrong, I'll come back and do another review, but as far as the consultant that did it was concerned, everything went perfectly well. It did take a few hours to get to the point where I had the operation, but I'm happy with it at the moment. Get a bit of blurry vision, which they say is normal. Slight headache, but again, you know, that's par for the course. And that's it really. I'm going to start with the eye drops, leave it a month and see how I get on. And in the meanwhile, I don't know if you can see, but that is the current situation with my eyes. Sorry if I'm grossing you out. But that is it. One good thing is, if you noticed, I did a review on the Oakley smart glasses. Well, they're transitional lenses, so if you happen to have transitional lenses, they're kind of useful too. So I went out into the garden and I immediately went dark for me, although to be honest I was closing that eye, but you lose a little bit depth of field obviously, so be careful of that. Again, because of my stigmatism, I've kind of been used to using the right eye for everything anyway, so it wasn't too bad. Anyway, I will no doubt do another review, hopefully without this eye looking like well, it was Halloween yesterday, so I suppose that's perfect. But please, if you have any doubts from a patient's perspective at least, I can tell you it wasn't anywhere near as bad as I had thought it might be. Although I've had friends and family that have had sometimes more than one cataract operation, and they've all said the same. So I believe in my friends and family now. Thank you for the advice, and well, that's it. Over and out. I will see you later.